is it going to take me to heal? So this is a great question. I get asked in the clinic all the time. Basically, how long until I feel better? How long is it going to take me to heal? How long is it going to take until I'm out of pain? It's a difficult question to answer with a simple answer because it all depends on a number of factors. So obviously it depends on your health status, your age, what's your past health history, so previous injuries, how well you heal, your current injury, how long you've had that injury for. They all play a factor into how long it's going to take you to heal, how quick you're going to get out of pain. And the problem is, nothing's ever a quick fix. We all want a quick fix. We want a pill. We want something that's going to help us get out of pain as quickly as possible. But the truth is, with any sort of healing, there is a time factor involved. So you cut yourself, you know it heals, it takes time. Your body has that ability to heal itself. But it takes time. And obviously the more serious the injury, the longer it takes to heal. Or the longer you've had the injury, the longer you've had this pain, the longer it tends to take to get rid of the pain, but also then it takes that much longer to return you back to a normal level where you're not compensating and you don't have these dysfunctional patterns. So actually it's quite a difficult question to answer, but to give you an idea, like muscle injuries can take you up to 6 weeks to heal. Ligament, tendon injuries can take up to 3 months to heal. For example, discs, if you've had a disc injury, they can take up to 18 months to heal. I'm not saying you're going to be in pain that long, but actually when we talk about healing, it means obviously a full resolution of that injury. So it can take a lot longer than you expect. For example, frozen shoulder, when you're diagnosed with that, goes through 3 phases, which roughly lasts about 18 months to 2 years for full resolution. It doesn't mean you're going to be in pain for 18 months, because at some point you just have stiffness and you don't have pain. So it takes a lot longer for you to have full resolution for you to heal than it does to get you out of pain. So it's never a quick fix, and pain tends to be the last thing to show up, but the first thing to leave. And I can illustrate this by, for example, if you look at a chart, you're out of no pain, you're fully healthy, have no dysfunction, no previous injuries, and then up above you have a level where you start feeling pain. And over time, over the years, you start to compensate, you pick up little niggles, and this develops from previous injuries, repetitive movements, poor posture, stress, and so forth. And it just builds up and builds up and builds up, and you start feeling a few niggles, but it reaches a point at when you really experience pain. Now, at this point of this chart, you feel pain, but naturally your body has ways of compensating or healing itself, or you can take pain medication to help reduce your pain, you can reduce inflammation. So oftentimes, once you've felt pain, you might dip into the painful period, and then you can dip out of the painful period. And you'll float around that line for a long period of time until at some point your body can't compensate anymore and you'll stay in the painful state. Now, even when you go see someone like a chiropractor, osteopath, physio, and we treat you, for example, we'll get you out of pain as quick as possible. So you dip out that painful threshold, but it doesn't mean you're fully fixed or healed. You're still floating just under that painful level. And over time, as you go through the full rehabilitation program, as you're looked after, you work on your flexibility and mobility, you strengthen up your weak areas, you get further and further away from that pain threshold into full health, or what we call kind of wellness. But obviously you're going back to your lifestyle that's caused these issues in the first place. So we're constantly battling against obviously lifestyle. So if you neglect obviously what you're eating and drinking, you neglect your health and fitness, you don't move enough, you don't get checked up on by a healthcare professional, you'll slowly creep back up to this painful level. And that's why it accounts for flare-ups each year, where you might initially only have one flare-up a year, and then further down the line you start having more flare-ups throughout the year, they're lasting longer, you're in more pain, to a point where that you're constantly in pain. And that is why, because you're floating around this painful threshold over a period of time, And then you get to a point where you can no longer compensate and you're literally in pain constantly. So how long does it take to heal and get you out of pain? Getting you out of pain is relatively quickly. You see that sometimes you can take medication for it and you're out of pain within a couple of hours, but actually you're still dysfunctional. So healing takes a lot longer and is very much specific for each individual. So when you come in for a treatment in our clinic, we'll do a full assessment and we'll figure out exactly what's going on, and we'll set the bar of how long we think it'll take you obviously to get out of pain, and then how long it's going to take for full resolution, which is obviously a longer period of time. So again, it's very much specific to individuals and it's not a quick fix. It's definitely a process to it, and that's why you see when footballers sprain their ankle, for example, they'll be out for 6, 8, 12 weeks. But as the general public, we think that we can be back running or doing activities we were doing before within a week or two, and it's just not the case. Of course, you can get out of pain in a short amount of time, but actually to prevent further issues in the future, or to get you functioning at a better and improved state, you need to go through a full rehabilitation program.